I'm Sandra López Verges. I'm a GYA member since 2018. I'm a health researcher and the chief in charge of the Department of Research in Virology and Biotechnology in the Gorgas Memorial uh, Health Institute in Panama. So I would like to talk to you about my experience as a young scientist during the COVID outbreak in my country. As the national laboratory reference for public health in our country, we are responsible of the diagnosis of any emergent virus. So before the arrival of SARS-CoV-2 in Panama, we meet with the Ministry of Health and other researchers and professionals of health to do the strategy of the country if there was an outbreak and introduction of the virus. So in our case, we were responsible to be sure that we have all the tools for the diagnosis at our institute, as well as training and increasing the capacities of other clinical laboratories through all the national territory. So this was one of the first time that the general population was aware that there was a local researchers working in science advice with the government to respond to this outbreak. And this was also really visible thanks to other experts that were helping with the science communication, explaining about the virus and why some decisions were taken based on data. This was also the first time we were doing research and surveillance, constant communication in real time, so we could give the best information to the authorities so they can take specific and informed decisions. So first, we showed that there was introduction of different lineage, and that because we were focused on following travelers from China and Asia, we were able to control this introduction, and we had only one introduction for China. However, we had many introductions from Europe and the US because the virus was already circulating in these countries at that time, but we didn't know it. And what happened? One of the lineage A2 coming from Europe was circulating in a cryptic way, so it was not detected until 1 month later. So it was already able to acquire specific mutations. So we had a new local lineage, A2 pan for Panama. And what was interesting is that because this was cryptic, when we compare sequences of positive cases with the epidemiological clusters of cases and contacts through epidemiological surveillance from the Ministry of Health, this specific local lineage was not detected in any specific cluster. So we were able to control all the other imports, but not this one. And this was also shown by different mathematical modelings that showed that early measures allowed to decrease a decrease of the expected cases, but and a decrease of the transmission rate, but that the virus was still circulating. At the same time that we were doing surveillance and diagnosis, the country responded really fast for specific research. So they opened a new grant for COVID. And what was really interesting is that this grant was open to all science, social science, basic science, technology, and health science. And this was really good because it was the first time that multidisciplinarity was really suggested, as well as contact collaboration and open science. And this was an important move for us because it gave a lot more of visibility of what local scientists can do and how they can help in their country to respond to specific crises like this COVID outbreak. But what was really important with this outbreak, it shows that pathogens do not have frontiers and that humans are not alone in the world. We're part of an ecosystem. So, One Health, Eco Health, and Global Health are crucial. We need to work all together as young scientists for a more sustainable and environmentally friendly society and a more equitable society with education and health for us. So we can do that all together from our research as well as through science advice, science diplomacy, and science communication. So I hope we can work all together, and thank you very much, specifically for all the people working really hard in this outbreak to try to keep as most people safe as possible. Thank you.